I'm seeing the document now, Farah.
Yeah.
So, Natin group, this is the four remedies that you have to do for this syllabus of comparative materia. Natrimur, natrum sulf, natrum carbonicum, and natrum phosphoricum. This one is always confusing for me. Though the spelling is natrium, they also like write as natrum, and also we say natrum. The rium is not pronounced, like I is not pronounced. So I really doubt what is the exact spelling also, or correct spelling, because whichever book I referred, it all showed natrium. So there is a confusion in the spelling. Anyway, it is the natrum group. And we have such a lot of other remedies which you don't have to study. Among this, borax. All the other things are with natrum itself. Borax is sodium borate. So that also is included in the natrum group. Then I have seen someone like some senior professors prescribing natrum as especially for respiratory complaints. Other than that, I have never seen anyone prescribing these medicines, or even I have not given. The natrum which I have prescribed is always these four only. And natrum carb also I don't think I have ever prescribed. It's natrum sulf and phosphoricum that I have prescribed. So we'll go to that. So about something about the element, the chemical characteristic. Natrium is the Latin word for sodium and the symbol is Na, and it is the alkali metal of first group in periodic table. I think it is in the same alkali group. Even potassium is coming. Potassium, sodium, or sodium, potassium goes like that. Uh, Now, sodium is the main constitution. My God, constituent. Constituent. Okay. So it is the main constituent of extracellular fluid. Yesterday we saw that potassium is in the intracellular fluid, the main important one, and sodium is actually extracellular. And it helps in to keep the body, the fluid balance, or the homeostasis within the body. Then excess of sodium, we call that condition as hypernatremia, and deficiency is hyponatremia. And both produces their own characteristic symptoms physiologically if there is hyper or hyponatremia. And regarding the analogy that is being applied, so sodium now we saw because it is an extracellular cation, and it is responsible to keep the fluid balance, like a internal harmony or homeostasis in the body. You can see that these people keep to have, or they are very keen to maintain relationships, especially one-to-one relationships. And yesterday when we were discussing potassium also, we saw that sodium has that one-to-one human relationship. They want to maintain such a relationship. Sodium is highly reactive cation, and hence it needs an anion to form a compound, which means like potassium, it will also not be remaining alone. It cannot exist and needs to be in a relationship. Sodium person also has a fear of people, and therefore they tries to avoid contact. However, they try to avoid contact or they avoid company, but they also fear of being alone. So it is more like they don't want to be in a crowd or a group of people. A one to one relationship is there, then they are happy. They can't live alone or independently. Not independently, not in the sense of current sense, a current way, like financially independent or something, but they want that emotional attachment, a close relationship always in their life. They can't live without that emotional attachment. Sodium persons are much more reactive, emotional, and sensitive. So, emotional mostly that they feel there is really no one for them in case they are not able to develop that relationship. And sensitive, when they are sensitive to other things, all the external impressions, be that physical or mental. So, even if it is some excess of light, noise, even music, they are extremely sensitive to those physical impressions, and they are also very sensitive to mental impressions. Any sudden unexpected things, even the slightest sad things, they will be getting gloomy for a long time. So they are sensitive to themselves from all these external impressions, be that physical or mental. But that because maybe they are this that sensitive, they also respond with great sensibility, especially to others, because maybe they know how they are sensitive and how easily they will be getting very much affected of others behaving to them. They behave very nice and sensibly to others. And they also consider what others say and think about them. They're very much bothered about it. And the presence of muriaticum, especially in natrum muriaticum, it brings in hatred and revenge in that person. Muriaticum means the chloride compound. Uh, we have another group of chloride compound, and it's not that chlorine alone is the, like every medicine in which the chlorine is the. So barium chloride, then what is that? This one, natrum mure, or barium chloride will become baritum mure, then ammonium mure, mag mure, all those muriaticum, because of that chlorine presence, they have that hatred and revenge, and which we can see in natrum mure also. Are you the Farah?
How do I feel?
Uh-huh.
How did you ask me how I feel?
No, no, no. I'm asking you, are you there? Because sometimes I hear
Oh,
you, yes, no. Today I was not hearing anything, so
oh,
just I
okay, okay,
asked.
okay.
Okay, fine.
Okay.
Yeah, there means that's enough.
Yes, yes.
Okay. Then constitution, either this person can be bulky, obese, or they will be with a very emaciated one like natramure, people who are having hyperthyroidism or marasmus. So they will be having that emaciated constitution. But the skin will be waxy smooth, which means they will be pale or anemic. So both the constitution is possible, but especially because natramure is more constitutional remedy, or that is the medicine we prescribe more frequently. The constitution more important will be emaciated, because they have that marasmus feature. Even when they are eating well, they lose flesh. What is seen in hyperthyroidism also. So temperament, because they're very sad, gloomy persons, so always melancholic, and also biliousness. And biliousness means bile or gallbladder related, so there will be complaints of indigestion, and this is more prominently seen in natrum force. So the complete natrum group, they have melancholic and bilious temperament. Melancholic, almost all the drug, okay, almost all the drug they are melancholic. When we go to natrum carb, even not oneself, we see some melancholy will be there with that person's. Ambitiousness is mostly towards the natrum force. Thermally, most are chilly. More prominent will be natrum sulf and natrum cup, but natrum mure is hot. Though natrum mure is hot, if you remember, because you have studied natrum mure have their complaints aggravated from sun and summer weather, but still they are having increased tendency to take cold. They will take cold very easily. Still, they are considered as a hot patient, but generally the natrum group are chilly. Diathesis is rheumatic and gouty. Then masam psychotic, especially psychotic, that we'll see in natrum sulf prominently. It's a very important psychotic remedy. Then direction of action, it will be centripetal, periphery to center. Ailments from mostly it is the mental complaints, because this is a melancholic remedy. I'm very much sensitive also. Most of the complaints are from mental level. That is mental conflicts, disappointment. It can be any disappointment, because they're one of the most melancholic group of people, or our remedies, or group of our remedies. So any disappointment is possible, but of love especially. Then also due to overstudy, But more than that, it will be the mental conflicts and disappointment, which is more important. Then so many food items like wine, milk, bread, and milk and bread are actually their aversions also. Salt and sugar. Uh,
I think they
yes,
desire salt.
yeah, but they do have ailments. That was what I was coming to say. They desire salt a lot. They will be taking salt a lot, but they do have ailments from mostly maybe hyperthyroidism, excess of salt intake, and that leading to the complaints.
I just have a
Then
question. What do you mean by mental conflicts?
mental conflicts, as such, the term I can't say, but anything that is going to affect them. It is not like a contradictions. In Auramet, Naxmom, Lycopodium, we see that they can't bear the least contradiction. When someone is saying no to them, at that moment itself, they will be responding. They may be even exploding to that person. But it is not that, not like that. Uh, it might be a inner fight among them, not like the conflict. It's always conflict. The word means that they are fighting with each other. Something is fighting with each other, but it wouldn't be like this drug, which is that anacardium, where we say that there are two wills, one saying them to do and one not doing. But this will be more or like, they will be the people. Uh, it's a chronic, if you remember, Ignatius chronic. So they will be thinking about the past, all the things, and will be having the sad, gloomy thoughts from that itself. Like in a way, something that happened in the past, they might think, okay, it shouldn't have been done like that. If it had done like this, it wouldn't have gone like that. I did like this, and hence it happened so. So a conflict within themselves. It is not with others actually. They rarely go to fight with others also. Even though it showed that hatred and revenge is there because of the chloride. I don't know whether it is during the syphilitic, but anatomure, usually the person is having trouble with himself, whatever he did, and the conflicts within him that he shouldn't have done that, or he should have done that better. It could have been like something, a talk had happened, and he even that talk can't be, he can't go back and correct that talk or something, but still this thing going on in mind. What would have happened if he or she hadn't talked like that? That type of thoughts always, the things that which it's not in his control now, thinking about it, thinking the other possibilities, what is the way around, what would have been the better way. That is mental conflict. And many of the people will be having these mental conflicts. Many. That's why Natramure can be one medicine that is very commonly prescribed, but very wrongly prescribed also.
Okay.
Then, yeah, loss of fluid, maybe because of menses, or they have got sexual excess. So, because of that also, because this medicine, especially natrum sulf, it is psychotic miasm, or
Mhm.
they have that gonorrheal poison. So, definitely they are having some sexually transmitted diseases and the miasm lurking. So the loss of fluid can be due to sexual excess also. Then the mental symptoms. When we go through the mental symptoms, you'll see that most of them it is somehow related to melancholy, sadness, etc., etc. So melancholy, they are very sad, gloomy, with periodical attacks of mania. So something like OCD, not yeah. Natron group are mainly OCD, but this is not OCD. It is bipolar, BPD.
Mm,
Uh,
okay.
so yeah. so they will be sad and gloomy with periodical attacks of mania. And there are mental effects of injury to head, especially after receiving some injury to head. Then they're having some mental complaints. We have similar symptoms, like you know how it says in arnica.
Miss, can you hear me?
I'm asking you, do you
Uh-huh.
know like this sentence, the underlined sentence, mental effects of injury to head? So some injury had happened to head, and
Uh-huh.
then mental complaints coming. That is what coming under natrum group actually,
Mm,
especially natrum sulf.
okay.
But arnica is also having some comparisons similar. Do you remember?
Um, no, miss. I
Okay.
remember it's good for injury and
Yeah,
apoplexy,
the
I think.
same
Yeah.
thing. Yeah,
Yeah.
the same thing, same thing. So arnica is a medicine that is good for injury to head. What you
Yeah.
told is true, but mostly they have physical symptoms.
Mm-hmm.
I mean, they can have that hemorrhage or the if it is not effusing out, it can be even um, like a what that term is called blue, uh, the blood being accumulating in the head region itself,
Okay.
and
Yeah.
then it producing some physical symptoms in
Okay.
arnica. Uh,
Okay.
it can be a stroke towards the nervous system. They say about arnica, some kind of this one stroke complaints or paralysis or anything we can get. So a person who is having injury on on his head, and if he is having physical symptoms, the medicine should be in the arnica. But if he is having injury to head and that producing mental symptoms, it will be in the natrum group.
Ah, okay.
So that's how we do that differentiation. So mental effects from injury to head will be in the natrum group, especially natrum sulf, natrum carb, or natrum mure. But mostly we see that sentence in under natrum sulf. But any natrum group can be given. But injury to health leading to mental symptoms, and if it is leading to physical symptoms, then arnica is our remedy.
Okay.
Then they have sadness and weeping because we saw that. I mean, in different pronouns, we can see that all the symptoms under mind is completely about the sad, gloomy nature and all. Different way they are expressing. So that much melancholic these persons are. They're sad and weeping always, thinks about the past and present things, and cry. And this is aggravated by consolation. That you always know. Amelioration will be pulsatilla. And aggravation by consolation it can be all the Ignatia, Natamure, and also Sepia. Then they are very pessimistic. In fact, they are a group of people who believe that they don't deserve to be happy, or if they are having happiness or some kind of happiness, they feel that in the next moment it will be a moment to be sad. There is a term to indicate such group of people. I'm not remembering now.
Mm-hmm.
So they negative people like pessimists, and also they believe that they shouldn't be happy, they should be always melancholic, or they are rather scared to be happy because they feel that will be followed by something very, very, very sad. So
Mm.
they have that feeling. It is forbidden to be happy because they feel that something negative or something sad matter will come up later. So they can't be happy. They're very reserved and introverted. That is, they're very closed or reserved people. They carry their problem within inside. They are not going to share it to anyone unless they trust or to that one-to-one relationship. Otherwise, they are completely reserved, keeping all their problems with themselves. And they are also introverted. We saw that they don't want to be in a society or in a crowd, but also they don't want to be alone. So they have that inclination to withdraw from the society, especially when they are unsuccessful to form one-to-one relationship. So someone that is completely reserved and introverted doesn't want to be in the society. They're highly anxious people, especially from downward motion. When going to downwards, there is anxiety of keeping balance. So this anxiety we can see while maintenance of relationships also. They're very oversensitive. I told you earlier. All the physical impressions and mental things can make them very much sensitive. So they are very sensitive to music. Music is an aggravation for them. Uh, Sensitive to music. All the medicines, okay, most of the medicines in Natrium group are very sensitive to music,
Mm.
to noise and other external impressions. Means light, whatever light, too much noise, anything that physically will be too sensitive for them. Even any unexpected thing could hurt them easily. Hurt not physically, but on a mental level. Even the slightest, the trifles are enough. They will think, they will brood, then they will feel sad. The different possibilities like that, it will go on. Maybe it was a very, very small thing, a small conversation. They could have just left that talk, which other people don't even remember, but Natrum Muir will keep it in their mind. So almost similar to Ignatia and Sepia, but Ignatia, it is in the acute stage. So
Mm.
Ignatia will be having a physical reaction to it, because we saw that they are hysterical. So they may physically react to such a thing. This will be like a Natramure, a little bit chronic, that they are keeping it within themselves. They are not hysterically manifesting. And Sepia, they're getting sad, but they go into an indifferent stage. That's
Mm.
how that the development of the symptoms goes. You told me that you are having Vitolca's essence of materia medica, right?
Yeah.
Yeah, so when if you are getting free time, all the three drugs are there in his book, Ignatia, Natamure, and Sepia. So read it like that itself. First you read
Okay.
Ignatia, then Natamure, then Sepia. So you will understand how the pathology he had taken it, going from one stage to another. Uh, so then the next one is hypochondriasis. Oh, they feel that they are very sick, they're anxious about their illness. So this is interesting because they have the digestive complaints. The degree of hypochondriasis increases with degree of constipation. So as the constipation is increasing, hypochondriasis or the anxiety about illness is increasing, and it decreases according to the degree of well digestion. So how much that there is a well digestion, that means the indigestion is less, that much they feel very well or they are less hypochondriac. So everything you see in the mental level, in the melancholy, the sad, gloominess, consolation, aggravation, always crying, pessimistic, reserved, introverted, and only something that will be different will be oversensitiveness. Anxiety from downward motion. This is more in borax actually, not the natrum group per se, but the borax. It is more anxious. But we can see in natrum group the anxiety to maintain relationship. That is they are having. Oversensitive and hypochondriasis. Then the physical symptoms, there is anemia, we told in the constitution itself, and leukocytosis. These are the two important features of natrum group. Anemia, which means already there is loss of vital fluids or the hemoglobin loss, something is the. So anemia is a characteristic feature. Emaciation is the. All natrums stimulate cellular activity and increases oxidation and metabolism. So this leads to increased consumption of oxygen and increased appetite also, but he loses flesh while living well. And in natrium, this losing flesh is more prominent in region of neck. This is used for actually differentiation. Clinically, I wouldn't say that much it is important because you get a hypothyroidism patient, even if there is no emaciation in the neck region, but you get other features of natrium, you don't have to stick like that. So in the exam point of view or MCQ point of view, there are statements like losing flesh while eating well. So there are remedies for lower limb, especially that one is abrotinum. Then in the neck region, that is natramur and sanicula, and the whole body, that is tuberculinum. So, but that is just for MCQ. Otherwise, I won't say you to use it or that tip for the even practice purpose or clinical purpose. I wouldn't say.
Okay.
Then, so this feature losses flesh while living well, is or living or rather eating. Maybe I took it from Boric. So eating well, this pathologically we can connect to the marasmus or hyperthyroidism, and this is a good remedy for hyperthyroidism. There is periodicity, especially the hot weather or every summer. We can see there is aggravation of complaints. And when it comes to natural self, it is due to the damp weather we see that aggravation. But we mm, yeah, natrum sulf is though with damp weather, but the other important remedy that is natrum carb and natramure both are having problem from sun actually hot weather. So they said about every summer in hot weather, uh, debility is much also seen, and that is due to the heat of summer and due to chronic headaches, which are worse every time when he exposes himself to the heat of sun. He will be very much debilitated. He wouldn't be liking to go to the sun. When you learned natramure, you might have learned its headache, and
Mhm.
the headache of natramure, we say sunrise to sunset. That's how we
Yeah.
say the headache of natramure. So it begins with sun. It get aggravated by noon, and it wanes along with sunset. So that's sunset to, sorry, sunrise to sunset uh, headache. So they are much debilitated. The natramure people, they wouldn't be preferring as much. If a way is there, they wouldn't be preferring to go outside in the sun, especially the noon time. They will be having complaints aggravated because natramure is a very good remedy for sinusitis or the headache, which is aggravated from going to sun. So they will be extremely debilitated also. We'll see that the natramure, I think I'm not mentioning it somewhere. I don't remember, but natramure are actually, they are very much sweaty persons, very much sweating, like calcium or the potassium that we saw. But though they are sweating, the sweating gives an amelioration for them. And
Mm.
when we see mercurius, there is sweating, but there is aggravation from sweating. So natramure, they do sweat, but there is an amelioration of complaints from them. But because they feel so debilitated and headache from sun, they will avoid going to in the sun.
Okay.
All natrams are very thirsty also, so that they are hot patients. Then their tongue is very characteristic, natrams, all the natrams tongue. One is there can be an abnormal sensation of hair on tongue. The symptom we can see even in silesia. And another is the cocking or the appearance of the tongue. One is the sensation. The second feature is the tongue will be mapped tongue or like certain patches here and there. And they say that patches will be like red patches or red insula patches or like ringworm, especially on the sides of the tongue. So when we see that tongue, it will be some patches here, there, and they call that tongue as geographical tongue or a mapped tongue, like a map. From here, there will be some patches. So if this is a characteristic tongue actually of natramure, and also the drugs, all the medicines which have some liver complaints will be having that characteristic tongue, this mapped tongue.
Okay.
So if you don't get remember during exam, if you don't remember that it is having red insula patches like ringworm, especially on sides, if you don't get that particular sentence, don't worry. Even if you write a geographical tongue or the mapped tongue, that gives a clue. I mean, that will be enough for.
Okay.
But this map tongue or geographical tongue, it means that there will be some patches here and there. So when we so examine the tongue of the patient, we feel like patches here, there, and it seems like a map. Uh, that is why it is called. So that tongue is characteristic feature of natrum, the mapped or geographical tongue, and then the coating. So some tongue, like it can be dirty greenish. It's not this dirty greenish or brown coating on tongue covered with mucus. Now, there is one nature also which I have not mentioned over here, but it will come. Natromure, I told you, it is the map tongue or the geographical tongue. Then another important medicine is natrum sulf and natrum phosphorus, natrum sulf and natrum phosphorus. And both these medicines, natrum sulf and natrum phosphorus, we usually, I mean, we give in potency also, uh, mostly natrum sulf. Natrum sulf is mostly given as a potency because it's a very good remedy for asthmatic complaints, respiratory complaints. Uh, but this medicine is also good for liver complaints. So, in case of natrum phos, the tongue will be appearing or having a golden creamy color coating, a golden like a honey color or a cream color, like that of a coating. And if it is very dark brown, it is more suited for natrum sulf. A dirty brown, dirty green, or dark green, like that it is natrum sulf. So the tongue of natrum groups are very important. One, in the matter of that sensation, particular sensation of hair on the tongue, and second, how they appear. So in case of natramure, it will be a map tongue or some
Mm-hmm.
patches here and there, especially on the sides of the tongue. And in case of natrum phos, it will be a golden or honey colored or cream colored, means light colored, light yellow, like that, coating on the tongue. And if it is natrum sulf, it will be more deeper color, brownish in nature. So the tongue of natrum groups are very important. Then craving, they crave for, yeah, you see, desires, but they do have complaints from salt actually. So they crave for salt, fish, and farinaceous food. And farinaceous food are those which contain starch, so like noodles, potato, pasta, etc. But they have aversion to bread and milk. Then modalities, all the modalities that we have told, like we saw that the sun is aggravation, their music is problem, they are oversensitive. Then seaside is also a complaint, especially for natrum uritica. Maybe that exposure to, though they like salt, it is problem for them. So even when they are going for seaside, it is the salty wind that is flowing on their body, and that excessive salt exposure, even that will cause some trouble for them. Even skin complaints, urticaria, etc., can come from that. Then milk lying on left side, mental exertion, and damp weather. Ameliorations from change of position, or rather this one is easy because I told you always, almost sweat and eating after. This will do. Aggregations you can connect from its common symptoms, general symptoms. And in Natron group, we actually have a lot of comparisons because it's all the remedies. All the remedies are actually can be considered for a constitutional prescription also. So we have got some many comparison, but it is not that long also. So in mind, all the natrums are very important. So in natrum, you're starting with, they have the psychic causes of diseases, ill effects of grief, fright, anger, etc. They're very depressed, especially in chronic disease, and consolation aggravates. They're very irritable. Child is cross when spoken to. Child is cross means they will be, despondent. They don't want to talk like the Chamomila Sina baby, but not that much despondent. They don't like when spoken to. and they gets into passion or get into an angry mode even with a small or slightest thing. That much irritable they are, especially children. But adults will go more or less into a melancholic stage. But they can be irritable also. Then this is an the important feature. They're awkward, or their hands, things will be falling from their hands very easily because there is nervous weakness. You remember any other remedy with this feature? Awkward.
Apis, right?
Yeah, it is. Then there wants to be alone to cry and also tears with laughter. The BPD we told. Then they have a characteristic dream. You might be remembering this symptom. They feel like that there are robbers in the house, and then they want to check it, especially under the her bed. So they go down, they check it, and then only she will be actually relieved. So a kind of OCD also. They do have BPD, especially natriumur, and also some kind of OCD also. And they're very thirsty people. We saw that all natrums are thirsty people, and hence they dream also of thirst or that of burning thirst. So melancholy is what it is projecting out with that awkwardness, consolation, aggravation, and somehow to bring the symptoms, because you can't write BPD or OCD in the answer sheet in Material Medica. We should bring those terms in patient's language, so the terms which indicates that they have OCD and BPD, bring that also. Then natrum carb, it is more showing this carb feeling, not feeling, the carb features actually. So we know the calcarea carb, baryta carb, all the carbs usually, even the cali carb, they are very sluggish in nature, mentally also. So that sluggishness of carb we can see even in natrum carbonicum. So they are imbecile. Imbecile means they are feeble or weak minded people, and they will be easily exhausted from least effort, mental or physical. And it is due to that carb effect. They are inability, they have inability to think or to perform any mental labor, and that causes headache. And if he is trying to do something forcefully, because that is going to be too exhausting for him, he feels stupefied, like a vertigo or complete, what is that, stupefied will be like a complete stupid disordered, uh, the arrest of functioning or whatever we can say. If he is going to do that, the comprehension will be slow and difficult. So all these things, which is from mental labor, too much mental labor, the comprehension, slow, difficult, imbecility, everything is coming from the carb present in that natrum carb. Then they also have the natrum feature, that is the melancholy, and also apprehension. Apprehension that we have mentioned that there will be anxiety plus or fear plus that physical symptoms related to it. They're completely occupied with sad thoughts. There is anxiety and restlessness during a thunderstorm. Yesterday only we discussed. And there is aggravation from music. In natrum self, they also are very sad, gloomy, irritable, especially in the morning, dislikes to speak or to be spoken. So this is a common feature that they want to avoid people, they don't want to talk, they don't want people to talk to them, but they want that one-to-one relation. She's also, Natram self is also depressed. Lively music makes her sad. We saw that in Natram Carb actually, music is aggravating.
Mhm.
Even Natramure, I didn't mention it over here. This is not given in the keynote, but even Natramure, they also have problem from music. Um this is important sentence in Natram self. He is having satiety to life and must use great self-control to prevent shooting himself. Then there can be mental traumatism, mental effects from injuries to head. This one. So
Satiety of life, that means he's content with life, or
he's done with life.
oh, he's done with life. Oh, okay.
Maybe because of his mental problem, melancholy, he doesn't have that desire to life.
Mm, okay.
Suicidal thoughts. He Done with life. That is the thing. Satiety is a word that is, or a name. I don't know how to say that word. Verb, pronoun, adverb. I don't know. Satisfactory, but or satisfied. And
Mhm.
satisfied is we stop something when we are satisfied, right? Or we
Oh,
don't
okay.
have a desire. But this, when applied to life, the living itself is done with living. It doesn't want to leave anything
Okay.
more. So because of that, and that's why he had to use great self-control to prevent shooting himself. It is so. And they're sad, gloomy, nothing. The Mendel effects from injuries to head, that will be the. So all the natrons are actually very sad, gloomy. The thing is very prominent in them. The natrum phosphonicum imagines for natrum phosphonicum, the Mendel feature is not important that much. But when I saw this symptom in boric, I felt like I will put in exam also. It is not that important even if you forget. But the other three I mentioned, the natrum cup, natrum sulf, and natrum mure, it's very important when the mind comes. So in natrum force, they imagine waking up at night. The furniture are actually people that he hears footsteps in next room. They are actually fearful. But to substantiate these symptoms, it shows that they are having some psychological problems or kind of hallucinations. But when we go towards the other symptoms, natrum force, we don't see that much of symptoms. We see some GIT complaints related, mainly natrum force. So I don't know whether this symptom is much important other than exam point of view or MCQ point of view. I don't know whether mentally this symptom of natrum force is important or not. But when I
Okay.
saw this word that pieces of furniture are persons, even normal person can feel like that, na? Especially in dark when we see some shadow.
Yeah.
I only have furniture, and if we had put our clothes over, I mean, some night if it suddenly open,
True, true.
you feel like if it is your jacket with that, the hoodie thing at
Yeah, yeah.
night. It can be, but I don't know. But when I felt so that I thought, okay, let it be. But exam wise, I don't think for this is important. So that is about the mind, the gloomy, extreme gloomy, and the natrum carb, especially the carb features, the imbecility, and in natrum self, the mental traumatism. Then in case of head is very important. All the natramure, natrum carb, and even natrum sulf also. The head symptoms are very important. So head is actually there will be headache for natramure. The constitution will be anemic and cachetic constitution where there is loss of vital fluids. It can be due to profuse menses or seminal losses. Whichever be the reason, there is extreme loss of fluid and that resulting in symptoms or mental affections. Then there will be great emaciation. The person will be losing flesh while eating well. Throat and neck of child emaciate rapidly. I told you already that emaciation will be more common in the neck region. So that is why head, when we say head, in material medical actually head and neck comes together. Though we don't mention head and neck, when we take repertory, it is actually head and neck. So that's why the neck symptom also came over there, and also as a constitution. The other symptom also I told you they have a great liability to take cold and headache in anemic people, especially school girls. And another drug, I mean in school girl headache we have a lot of medicine, but another medicine which says as like that itself headache in school girls.
Hmm.
You remember?
I don't remember that name.
Mm, Calcaria Force also says like that in school going girls. And the headache is actually from sunrise to sunset and during and after menses. It's left-sided clavus. Do you know what is the meaning of left-sided clavus when you say like that?
Mhm.
Left-sided is this one, and the clavus means the exact word meaning I would like to check, but this left-sided frontal, or not frontal, which is this area, temporal. uh, that pain, the left-sided pain, and
Uh-huh.
clavis something like very pointed. Hmm. The clavis is something like a very pointed type. So, what we say in this remedy, what is that? Mm, mhm. Like a nail. Uh,
Okay.
because later in the pain nature, they say that as if thousand little hammers were knocking in the brain. So left-sided clavis means when it is knocking with a hammer, it is actually towards a point, a particular point. With a hammer, actually, we are continuously doing or striking on a similar point, right? I'm not a similar point, the same point. That's how we use the hammer. It's not that when we are piercing a nail, it is not that one strike is nearby and then another strike is somewhere, not like that. It is on the same point we are continuously knocking. So left sided clavus means that pain will be continuously on that particular point itself, a pointed one, like a hammer being striken, and that will be left sided. That's the meaning of using this term together, left sided clavus, with red face, nausea, and vomiting also. So, headache as though a thousand little hammers were knocking in the brain, and this left-sided clavus and a thousand little hammers means the same thing. Like now, I'm showing the right side actually, just because I don't know what it's right like this, but it will be like this.
Oh,
The
okay.
headache will be felt like that. That is left-sided. I mean, if it is in the left side, that left side, the clavis or the thousand little hammers striking means they will be having the sensation that the pain is concentrated in that particular point, continuously striking. Like in yesterday Calicap, we saw that they can point out the pain. It will be under one tip of the finger, like that pointed pain. Similar is natremure also, the natremure headache, but it is like in Calicab it was constantly present over there. But in natrum, it is like constantly striking over there. Okay,
Um,
that is the difference. One is constantly present over there. This is like clavus means they are in that particular position, coming and hitting that particular position.
okay.
So, and with red face, nausea and vomiting. This nausea and vomiting usually we see along with migraine. Red face, we can go towards congestion also, like belladonna, and we have seen that these medicines are actually having headache when they are going to the sun. So that congestion can be there, but still it is not as prominent as like the congestion we see in belladonna. Then headache is ameliorated by perspiration. Headache begins with blindness, with zigzag dazzling, or that blindness, or that because they are going to the sun, that extreme sunshine is going to cause a problem to their vision also. So the this headache starts with the blindness, and this is actually a feature of migraine. Migraine
Yeah.
headache starts with like that. So they have that blindness or that dimness of vision, a zigzag dazzling or the shining light causing problem for them, and then it will uh, lead towards a throbbing type of headache, and also headache from eye strain. Then there will be lacrimation associated complaint. Tears stream down the face whenever he is coughing. Lacrimation is a characteristic feature or a associated symptom that they will be having. In case of Natran cup, the constitution, they have got great aversion to open air, extremely chilly patients, and dislike to exercise, be that mental or physical. They are highly debilitated from heat of summer and exertion from least effort, mental or physical, and ready to drop even after a small walk. Then they have that chronic effects of sunstroke. Now, with the return of hot weather, they suffer from headaches. So, the people who once got sunstroke, and whenever that, though they got cured from sunstroke, but every time the sun is there, if headaches are returning, natron carb is a good remedy. But you know, other remedies for sunstroke, you remember?
Glonoin.
Yes.
Um, mm,
Another one is also with G.
oh, with G. Mushrooms.
Gelsemium and
Oh,
also
Jocelyn.
laxatives.
And like this. Okay.
Yeah, these are some important sunstroke remedies. So complaints from sun. So natron carb is also there. So, but natron carb, I would say if someone is coming with the next complaint, especially headache from working under gaslight, I may give natron carb at that time. Sunstroke, I would be going for glonoine initially,
Mm-hmm.
gelsemium, and then only will be coming towards natron carb. But uh, I'm just making a comparison, okay? Because when we have so much remedies, we need to know which is best acting. And sunstroke is something very acute that we need to give the medicine very, very soon. A sudden action comes up because glonoine do have that congestion, even belladonna, but congestion and sunstroke people will be having the temperature raised also. Such a feature, natron carb, they are not saying. They say that they have sunstroke, but more or less it is the chronic effects, not the acute effect. So acute, mostly we'll be going better to go towards glonoine, gelsemium, laxasis, because these medicines are good for decreasing pressure also. The sunstroke at that time there can be increased pressure of body. So we can give those medicines which have action also on decreasing the pressure. So this is more towards the chronic effects, like the return of hot weather, the patient will be having headache. But the acute headache, which is coming from the Mandela exertion sun is there, but the other, the bluish one I gave, the headache from working under gaslight. And working under gaslight means, the people working in machineries where there is huge Petromax lamp lights that is being used.
Mm-hmm.
Mm, I don't know. The mechanical shops here for welding, they will be using
Okay.
some fire
Uh-huh.
to
Yeah.
weld.
Yeah.
Yeah, so people working under that, and then they are having headache. Natron is good medicine. That is a good remedy. But if some person comes to you and their occupation is like that, welding and this like working in fire, burning, I mean furnaces, and then they are having headache, natron carb is better indicated. And headache will be before menses with tension in nape of neck or occiput. So natrum curve is having a occipital or the nape of neck headache. Natramure is mostly the frontal region, the temporal region, the left sided clavis we told. And natrum curve, they have a sensation that this head feels too large as if it would burst, doesn't matter even if you forget. More important will be this one, aversion to open air, whatever I put in blue, that a dislike to exercise, the avoiding open air, and even greatly exhausted from sudden walking, the chronic effects of sunstroke, and from headache from gaslight, especially occipital. So that will be the important features. Even natrum self is also having headache in the base of the brain or occipital. So the constitution will be there like the Gravagol's hydrogenate constitution, like Tuja, Antimtat, Calcarea. So they are complaints of the people who are having complaints from damp weather, damp houses or cellars. People living in a cold weather always, or in the cellar region where it is cold always. And what we told the hydrogenate constitution is they can't live near to a water body and they can't even have food, fish or even some seaweeds or any vegetable like which are grown in water, they can't have that. They will be having complaints. So our medicines for that is called as hydrogenous constitution. And whatever I told now, calcarea, thuja, arania, this one, natrum sulph, a very good remedies. There's still more, but these are some of the remedies that is coming into my mind now. So they have the
Okay.
complaints from dampness of weather, damp houses or cellars. Other two, natamur, natam cup, what we saw was exposure to sun, hot weather, but this is damp houses or dampness. So patient feel every change from dry to wet. They cannot tolerate sea air nor eat plants that thrive near to water. A constitution in which gonorrheal poison is most pernicious and they recover slowly from every sickness. So psychotic masm is more prominent in case of natrum cell. There is mental traumatism, mental effects from injuries to head, chronic brain effects of blows and falls, and they also will be having this a headache, not headache as such. They will be having complaints of meningitis, the spinal meningitis, where the pain, the crushing noise type of pain is very characteristic and base of the brain, and the head will be thrown back, spasms with irritability and delirium, the typical feature of meningitis. Violent congestion of blood to head, delirium, opisthotonus, etc. So the head symptoms, natremure, left-sided, temporal or the frontal region, and natrum curve from the gaslight, especially in the occiput nape of neck region. And similarly, in case of natrum sulph, mostly from damp weather or dry to wet exposure, and also the mental traumatism after blow, and usually that will be happening in the basal region. So for the basal or the spinal meningitis. Another important remedy which we will, which is good for spinal meningitis or the basal meningitis is tuberculin. They also have similar symptoms. And there is opisthotonus. So that's about the head. Now going towards the respiratory system. In case of natrum carp, the face is pale with blue rings around eyes, which shows their anemic nature. And this is very good for the PND. That is the nasal discharge dropping into the throat. Um, so mucus are present in throat and posterior nares and constantly hawking to clear throat. And when the person is lying down, they will be dropping into the throat from the posterior nares. That is an important feature of natrum cup. But we do have other medicines also, so we need to differentiate and find whether natrum cup is suitable constitutionally or not. Like we get that sun exposure aggravation, then it is more going, and that melancholic nature, then it will more going towards natrum cup. Oh, otherwise we can go for other remedies like Cali group. These droppings, I mean, the lying down and the posterior nares from the throat moving towards throat. We can think about other respiratory, Moxol, Thuja, Silesia. So many medicines are there. But if to prescribe natrum cup, we need to be sure of their constitution. The profuse discharge during day and stopped at night. In a way, it is very good. Though this complaint that the posterior nares from that the discharge is constantly dropping towards the throat, it happens usually because of gravity when the person is lying down. However, these people will be having discharge throughout the day, but when he is going to sleep, it is getting stopped. But this stopping is also a problem because it can bring more complaints. The discharge being stick over there, it can bring about headache also. Both are there. They don't have to get up in between to remove, I mean, to uh, dispose that discharge because it is stuffed up, but it can cause other trouble. Then thick yellow green offensive musty discharge. The discharge how they express is either yellow green. And whenever green color is shown, I have told you it shows the psychotic miasm, psychotic
Okay.
syphilitic, psychosyphilitic. So the green offensive musty discharge from nose, often ceasing after a meal. This is something that is, I have seen that. I mean, prescription point of view, I don't know, but I have seen for exams this term giving much importance that that discharge ends after a meal. It's kind of amelioration feature, so they have been given. In natramute, the respiratory system is not much. One thing is their lacrimation always whenever he is coughing. And the second feature is hay fever. They have that allergic rhinitis. So whenever the person is exposed to hot sun or intense summer heat or even the spring season, the hay fever will be coming out and he will have that screaming sensation in the nostril that some worm is moving about. That feature will be there. So natriuretic is more indicated in respiratory complaints for the allergic rhinitis, the hay fever. And when we go towards natrum self, this is more deeper in the lower respiratory tract, or we have the symptoms of pneumonia, COPD, asthma, that symptoms. So in natrum cup, it is more in the posterior nares and also the throat. Natrium even external, like in the nostril region for the hay fever, and natrum cells will be deeper in the lower respiratory tract, and then we have more severe symptoms also. So we already told that the complaints are arising from dampness of weather. So starting, they will be having nosebleed during menses, not the vicarious one. I told you that there is vicarious menses in pulsatilla, bryonia, and also phosphorus we have. Instead of menses, nosebleed will be happening. But there is menses happening, but along with that, there will be nosebleed also. But I have never seen such people. Maybe they got it improving. But in natural self, there is nosebleed during menses. Dyspnea, though the person is having complaints from dry to wet, see the next sentence, they desire to take a deep breath during damp, cloudy weather. There is humid asthma. Humid asthma means much expectoration of phlegm is there within the chest with every change to wet weather, and still they have dyspnea, and then in that dyspnea, they want to take breath in that damp weather. With every fresh cold, always worse in damp, rainy weather, and then they discharge. The sputa uh, greenish copious, no need. Sputa greenish and copious, which is showing its psychosyphilitic nature. And the psychotic pneumonia, the lung affected will be the lower lobe of left lung. There is great soreness of chest. During cough, has to sit up in bed and hold the chest with both hands. So this is an attitude they keep up during coughing. It is exam point of view. It's very important. So remember the symptoms going deeper and becoming more severe also.
Mhm.
In GIT, GIT mostly among the natrum, though I have put some symptoms here, the most important medicine for the GIT complaints is natrum force. So natrum force usually is given for actually acidic complaints or indigestive complaints as a biochem. But because there were interesting GIT symptoms for other drugs also, I put it over there. In case of natrum cup, they are having aversion to milk and they're having diarrhea from it. In case of natriumure, the cravings we have put, the salt or great aversion to bread, but that salt or bread, it will be bringing complaints for them. Then the nature of the tongue, the sensation of hair on tongue, the this one, the mapped tongue, and then in the tongue, they also have heavy, difficult speech. Like the children will be having much difficulty to speak. Tongue will be very heavy, and in those children, there will be slowness in walking also. So the milestones are much delayed in case of natriuretic children. Speech is delayed and also walking is delayed. But this GIT symptom of natriuretic is very important, constipation. And constipation, this is important, okay, constipation of natremure. They have a sensation of contraction of anus, that anus being contracted. And if the anus is contracted and stool is dry and large, obviously it is going to tear up the anus. So contraction of anus is there is tearing of anus, so that there will be burning pain and also bleeding and smarting afterwards. Smarting or that burning type of pain. Stool will be dry, hard, and difficult, which is crumbling. Crumbling at the verge of the anus. That might be a term that you have learned in some other drugs, which means it will be breaking off. Because if it's too dry and also the anus is too contracted, the person has to push, and then only some stool will be crumbling and falling, otherwise not. It shows the pathology, the anatomical pathology in the anal region being contracted. For the fistula, we can see. And this feature, the constipation, is actually a characteristic feature of the muriaticums. So if you go for the drug ammonium muriaticum, then the next one, Macmure, Natamure, all these muriaticums, they have this constipation where the anus seems to be contracted and they have that crumbling stool. That's a feature of muriaticums actually. So because Natrum muriaticum is also having this same symptom, and it is involuntary actually, knows not whether fetus or feces escape. So this is one feature, that there is contraction of anus, and after passing of stool that is dry and hard, also crumbling, the anus can tear and there will be a smarting pain. Sometimes the stool will be actually involuntary, where he doesn't know whether the flatus is escaping or the fetus is escaping. And Here we can compare it to aloes actually. So because of constipation, Natramure GIT is important. And but our actual remedy, which is very important in GIT, is actually the Natramphos for the acidic complaints, indigestion. So Natramphos, the remedy for conditions arising from excess of lactic acid. So there will be acidity, often resulting from too much sugar. Ailments with excess of acidity, though everything will be sour, sour irritations, sour taste, sour vomiting. There will be canker sores or aphthous ulcer of lip and cheeks. I told you that coating of tongue is very important. So phosphorus, it will be a golden color, a yellow creamy coating at the back of the roof of the mouth and tongue. So it will be in the roof region towards the back or the posterior part, where we can see that golden yellow or a creamy yellow coating. The term golden also. Then there is inflammation any part of the throat with sensation of lump in throat, thick creamy membrane over tonsils and soft palate dysphagia. I won't say you to remember this symptom. It was symbolic, so I just put it. Then there can be flatulence, natrophosis, because there is indigestion, this acidic symptoms, there will be flatulence, and colicky pain with symptoms of worms. And it will be showing that psychosyphilitic nature with a greenish discharge. So here it is the indigestion, especially due to production of excessive lactic acid, everything that is tasting or discharges of sour nature, and the nature of the tongue with flatulence, that is more important. And usually when we are giving lycopodium, carboveg, nux vomica, etc., for indigestion, persons who are having the indigestion, as I told yesterday, Natrophore's is a biochem gave with that, with this
Mhm.
complaint. Then we have natrum sulf, and actually they have complaints due to the liver. So, starting with the toothache, they have aggravation from cold water and cool air, because we have seen that they have heterogeneous constitution, having problems from too much exposure to cold. But the tongue is very important. The tongue will be dirty greenish gray or brown coating. So remember the tongue. That is why the GIT becomes more important. So natrum force that yellow colored or creamy colored or golden colored, and if it is dark dirty, it will be natrum sulph, and if it is matte tongue, that is natramure. And in natramure, there is constipation. Natrum force, there is acidic complaints, flatulent complaints, diarrhea, which is greenish in nature. And here, in case of natrum sulph, it is because of the cold exposure. So liver complaints will be there, and hence the clotting, the dark clotting, and diarrhea. There is sudden urging, gushing, much flatters, blah blah blah. Doesn't matter that much. The third sentence, after a spell of wet weather, we have already seen that people are having a hydrogen constitution. Same with living on working in basements. But this sentence is important. On first rising and standing on the feet. Can you say me? Can you make a guesswork why this sentence is important?
On first rising. Oh, well, what do you mean?
What that sentence is important.
What?
On
Why
first,
it's
yeah,
because they
diarrhea.
have to rush to the toilet right when they wake up, I guess.
Yeah, but that I agree. That is what
Uh-huh.
on first rising and standing on the feet. But do you feel, I mean, do you think there could be any other reason? Any other reason means why standing on the feet they have a diatic sensation?
Mm, I'm not sure, miss.
Just make a guess. Wild guess.
Why
Standing on the
they
feet.
rush?
Standing on
Mm.
the feet. Because we have told the reason somewhere. Didn't connect like that. And it's just a connection needed here.
Hmm.
What is the
Oh,
main
but is it
constituent?
because um I'm not sure, but like could it be because when they wake up, when their feet touches the floor is kind of like wet.
Yeah,
So
yeah, yes,
yeah.
the cold. That even
Uh-huh.
that coldness is enough for them. That coldness is enough for them to induce a diarrhea or a passage of stool. That's more important symptom. There are people actually. That's why I gave importance. It's not just MCQ wise or exam related. It is important. There are people who are having this symptom. I've seen
Yeah.
that clinically. So that is with the GIT. And then musculoskeletal. Musculoskeletal, we saw rheumatic diathesis and all, but they have some interesting one-word symptoms actually, especially natramure and natrum cup. In case of natramure, there is painful contractions of the hamstrings. You remember any other drug you have studied this symptom? It is also
Sounds-
mure,
mm,
ammonium uraticum.
oh, okay.
Ammonium uraticum has also got this painful contractions of hamstring. Another one, another remedy is the that's actually rare guacum,
Well,
and also yeah, and also Cimex or Cimex. However, I say Cimex, however you say that. But if even if you forget guacum and Cimex, it doesn't matter because of that muriaticum, stool muriaticum. Remember the stool in case of natrum mure, it was crumbling stool. The same with the stool of the ammonium muriaticum, it was also crumbling. And then in natrum muriaticum, we have this contractions of hamstring, and that symptom we have in ammonium mure also. And one symptom, the heavy, difficult speech. Children slow in learning to walk and talk. We can put in musculoskeletal because they have that slowness of walking. So we can put in musculoskeletal also. And in natron carb also the comparison we can see in natron mute. Though this symptom, which is explained in natron carb, is not told in natron mute per se, but they are comparing. So in natron carb, there is easy dislocation and spraining of ankle so weak that it give way. I mean, they will be having that frequent dislocation. Using high heels is not possible, or walking fast or running is not possible. They will be having that easy dislocation. There are people who have knee dislocations very commonly, and like that. I mean, just one of my friends, she always had this dislocation of shoulders. Uh,
Okay.
and I don't know how, because they have dislocation and they also know the self management. They can keep it back in the position also. I don't know how do
Wow.
they do that, but I have seen both. This dislocation of the shoulder I have seen in a friend who actually was my BHMS classmate. She had that problem, and then dislocation of the patella.
Mm.
It will also, because it all these joints, I forgot the name of the joint, but they are very loose connected. The both the patella and the glenoid over here can be
Mhm.
easily slipped off. So they know the management actually. But this one was very I mean, I don't know how could she do that in BHMS. Once she was crying out of pain,
Uh-huh.
and then she told the matter. We were in the hostel. We were living in a dormitory, and
Uh,
she had a pain suddenly. And we were like, "What happened with the first year?" We don't know much management almost. Hello. Then she told, it's okay. And she herself, she didn't allow us to touch her body. She herself kept her, this one, humerus back into the position to the glenoid. And she told that actually, when she was in sixth or seventh standard, she was traveling by bus, and the bus took a sudden turn. She was standing, and it got dislocated. And
mm.
after to that, then she was taken actually to the hospital. But the joint became weak at that moment. And
Mhm.
then she has even slightest exertion or something she do without care, this can dislocate. And she put in position. Then the other one I saw the patella dislocation is
Mhm.
actually a lady around 45 years. And she was a nurse actually. I mean, she is a nurse. So maybe like that she learned the management. But she
I
also know how
see.
to bring it back into the position. They don't want
Cool.
to go. Yeah, they don't want to go to the orthopedic. So these people, the Natron cup, they have that easy dislocation and the weakness or the spraining in the ankle region actually. So weak that it gives way at foot bends under. So they can't walk properly. It will be always bending. You see that in Natrum cup, Natrum mute. And you remember any other drug which is having this easy dislocation? Starts with
Mm.
L.
L.
Yeah, one of the most prominent rheumatic remedy from L.
L. Mhm.
Shall I say?
Yeah, sure.
Ledampa.
Oh,
You studied
okay.
that drug?
I don't think so.
Okay. So Ledampa is also having similar symptoms. Then natropause, that's so many symptoms, the hamstring sore, rheumatic arthritis, but this could be a symptom, the rheumatism of knee joint with that crepitation. I hope you know the crepitation, especially in a way when
Mm.
we ask the patient to lift, not lift actually, extend the knee joint
Mhm.
and then ask them to uh, flex it back. And we keep our uh, uh, palm on that knee joint, we can feel that some kind of movement. Have you felt
Mhm.
that? The crepitation?
Yeah, yeah.
Yeah. Or if you have never felt, if in case your grandmother, yeah, there was a grandmother, na? I mean, there is a grandmother. You can feel that it's so physiological. Everyone above the age of 60 will be having OA, and they will be having that. Natron is given as a specific for that symptom. Some doctors, okay, there are doctors who give proper medicines, constitutional, but I have seen doctors giving synovial crepitation, Natron 6x as a specific. Other sentence, yeah, it's just putting what is that? Some spices here, but the most important in case of rheumatism will be this. Then in urinary system, because this is a gonorrheal or psychotic medicine, in Natromure, they don't have gonorrhea, but they have some crazy symptom. There is involuntary urination when walking, coughing, laughing, etc. We already saw that lacrimation. When
Mhm.
they are coughing, there is lacrimation. So like that, there is urine flow also. when walking, uh, from walking alone, laughing, coughing, etc. And then there are also another strange feeling. This is something is you can commonly find has to wait a long while for urine to pass,
Okay.
especially if others are present. And after to that, there will be cutting pain in urethra. So this urine involuntary is important, and also to wait a long while for urine to pass. If others are present, that is the. Then in natrum self, it is more related to gonorrhea. So the discharge, the greenish discharge, which is painless and thick, that is in natrum self. In reproductive system, it is mostly related to seminal emissions and that leading to sterility. That's what we have in these remedies. So in natrum carb, there is discharge of mucus from vagina even after an embrace, and that can cause sterility. Uh,
How does it cause sterility?
it can be also related to impotence.
Mm.
This is something I have a doubt that from vagina mucus releasing just after an embrace and how that can lead into sterility, because I couldn't connect it with any of the practice of medicine condition. So I didn't get a proper answer or reply from anyone who I have asked. So the possibility they told is there could be some uh, what is that? I mean, it is causing sterility. So this could be a personal, not personal, like not a pathological or disease condition, but well, we can explain it via some disease. But the lady might be having actually impotence. Not, ladies are not impotence. We call have to say them sterility. But some people were there that were connecting it with um, tuberculosis.
Mm-hmm.
Um, then the discharge coming out. So in tuberculosis already there will be sterility, and then some people connecting it with uh, the excessive cervical discharge. So that discharge might cause a block for the this one to go, the sperm to go, or
Uh-huh.
the acidic nature of that discharge, because during the reproductive phase the female discharge should be actually alkaline, uh, yeah, and not alkaline, alkaline, yeah, alkaline, then only the sperm can actually survive, otherwise they are going to get killed. Before two periods, and that is in older age and also in young age, the discharge is actually females, the pH is actually acidic, but not in reproductive age, it becomes slightly alkaline, so that the sperm is not destroyed. They say it is related, what they could say, but no one was very sure. The cervical mucus being excessively acidic in nature, so that they are destroying the sperms, and hence the sterility is being resulting. But why it happens after an embrace, I couldn't connect that. Then I just got satisfied, and also I never got such a symptom from any patient. I never heard it from any patients. And this might be a symptom, all these things came up during the proving. Maybe at that time they got, but now how I could connect it, it's this way that I told you, the cervical mucus nature, like that leading to. But anyway, this is actually an important question for MCQ. That is the reason.
Mm.
MCQ, they can ask like the sentence, discharge of mucus from vagina after an embrace causing sterility, because we will always ultimately remember when we have a lot of drugs to study. Natron usually essay is not asked when I was studying. Okay, essay is not
Mhm.
asked from natron. They just ask natron head because of that gaslight headache, chronic effects of sunstroke, and the mind symptoms. So that's only what we learn, and ultimately we forget that natron carb has got such a symptom also. So then when MCQ come and four options are there, will be and they will be keeping the medicines, like sepia, then other sterility, lycopodium, uh, which other medicine can be the oconium also. So when we see these remedies, we feel like okay, lycopodium, sepia, conium, everything can be importance. And then that fourth option will be natrum carb. Oh, never natrum carb. If we have not studied, if we have not studied, we'll be like, oh, never natrum carb. Delete it. And we'll be concentrated on the three other drugs. The actual answer will be so that Meteorologica, when they are asking MCQs, they can ask crazy questions. So it is one of the crazy questions. Though I don't know how to give a proper explanation, or the explanation what I gave you, is it correct or not, or to what extent it is correct, even I am not sure. They have a bearing down sensation, which means the uterine prolapse. It's good for that. Though we have better medicines for that. They have that bearing down sensation, and it is aggravated from sitting, amelioration by moving about. Then when we come to natramures, the same natramure we can see here also prolapse. There is a pressing, pushing towards genitalia every morning. But here they are actually having amelioration from sitting down to prevent prolapse. So
Mm.
prolapse is there in natron carb and natramure. But in natramure, they have to sit to prevent the prolapse. And in natron carb, sitting is aggravation. They have to move about. But Nataka being prescribed for prolapse is very rare. Okay, we mostly go for medicines like Sepia, Murex, then Helonius. Yeah. Uh, then in Natramure also there is some discharge, seminal emission soon after coition with increased desire. There will be weakness of organs with retarded. It's the spelling correct? Retarded. It should be D, right?
Ah, yeah.
With retarded emission during an embrace. So both of this, even in lycopodium we study. Lycopodium, immediately after an embrace, the discharge is coming, and then the person goes towards sterility. If it is coming in a female, sorry, if it is in a male, we understand the connection because there is no proper orgasm is happening, or there is a impotency. That is why that sudden discharge of the semen, and then of course there won't be any the it will lead to infertility or sterility. The person will not be, I mean, they can't conceive the baby if the discharge is happening premature. So in males we can connect, but how in females it happens, that's I don't know. So we see this symptom in natramure in males actually, the weakness of organs with retarded emission during an embrace. There is impotence and spinal irritation or paralysis after sexual excess. Same, somewhat similar symptoms. Then lastly, in case of natrum force, they also have the same sterility with acid secretions from vagina. So that is how my teachers actually connected the symptom because
Mm.
they were not able to explain it properly. So this acid secretion during an embrace, so maybe they are also satiety. I don't know how to explain. Anyway, all the natrum have got that symptom. Then leukorrhea, in case of natrum force, as like other discharges, which is yellow, creamy, the tongue nature. Even the leukorrhea is creamy or honey colored and acidic or watery. There can be sour smelling discharges from uterus, morning sickness with sour vomiting. So this sour nature, we can connect it to the indigestion problems, not the uterus one, okay? This one, the morning sickness. The sour smelling discharges from uterus can be just a common symptom. Then here also there is emissions without dreams with weakness in back and trembling in limbs. There is desire without erection, gonorrhea. So they do have sexual complaints. So maybe this psychotic sexual complaints or gonorrhea related is resulting in that uh, discharge of the discharge being released during the MPIS, resulting in infertility in all the three remedies, in one way or the other. Then lastly, it is the skin. It's the last, right? In skin, natural skin is actually more important. You might have known the hair falls out in especially nursing women or the women who are in during their lactation, and the face will be oily, shiny, as if greased, or pale, anemic, waxy skin. Then they have the hanged nails, the skin around the nails dry and cracked. Herpes about anus on borders of hair at nape of neck. They also have eczema, where it is raw, red, inflamed, especially on edges of hair, from eating too much salt or going to the seashore or from ocean voyage. That sea wind causing problem. There can be urticaria, especially after violent exercise. Can be acute or chronic. And lastly, there will be warts on palms of hands. Uh, and that will be so to touch in natrum cup. So palms of hands, what there is natrum new, natrum cup, and over this dorsal region, we have medicines like dulcamara and tucha, tucha or ruta. Do you remember? I remember the term DTR. Dulcamara is the, along with that, it is ruta, I think. That I can. Skin warts on back of hands, dulcamara and tucha. So back it is DT, and then if it is back DT, ruta is actually along with natramute. It should be on the palms. Let I confirm that also.
Miss, why do they have urticaria after exercise? I thought sweating ameliorates for them.
Huh. But even I mean, I can't give you a correct explanation. But
Mhm.
sweating amelioration, yes, but it is not related to sweating, I think. It should be something else associated. Um, sweating ameliorates. Then, if you are connecting that sweating and that release of salt and that causing an urticaria, sweating should have been an aggravation. And I don't know.
Mm.
But I will give you this why urticaria after violent exercise is important. I will give you 1 second. Let I confirm with this what's. Yeah.
Okay.
What's ruta is along with natrum group. So it is
Okay.
natramure, natrum cub, and ruta on the palms, and DT, the camera and tuja on back of the hands. And why urticaria is important, more than the urticaria, it is actually the possessions of urticaria. So there are a lot of urticaria from different reasons. Yeah, and with this actually we had to study for the MCQ purpose. So I'll just read because there are a lot of urticaria and we have to study this by heart. So urticaria with gastric derangement, just here, okay?
Okay.
Gastric derangement. We have the medicine Nux vomica. Urticaria from shellfish, Urtica urens. Urticaria from cold, there is Dulcamara. Urticaria from exertion or exercise, we have Natramure and Sorinum, most importantly. But other remedies are Epis, Calcarea carb, Hepatic, Sanicula, but not that important. Then urticaria with rheumatic complaints, once again Urtica urens. Urticaria with asthma, Epis. Urticaria after meat, Antimcrude. Urticaria after wine, Chloralum. Urticaria from suppressed intermittent fever, it is elaterium. So this we had to study by heart because we had the problem with this thing, viva voce. So if we say something or something because natramnure is given for allergic rhinitis, means the allergic complaints, and if it is local one, the skin, there can be an urticaria. So once they one like anatomy is a medicine that we usually prescribe clinically also, and also when we go to exam, and when we had our exams, our prescription will be first BHMS, second BHMS. Our prescription will be with safe medicines. We won't go for some rare complicated medicines. We won't go. So it will be usually mercurius, sulfur, rustox, bryonia, pulsatilla, natramure, nuts vomica, lycopodium. Our prescription will be surrounding these 5, 10 remedies. Okay, not nothing more than that. Somehow we will do some manipulation, not big manipulation, but some manipulation and bring the medicine towards that drug. So once we have prescribed natramure, and this is actually a technique our teachers say us, so that we don't get into problem,
Mhm.
especially from the externals, because if we put some dire remedies they are going to kill us with the medicines. So when they reach this natramure prescription, and then they may ask for the skin, and when we are saying about the skin of natramure, obviously we will be saying about urticaria, and the question will be never about this, like the way you ask, because your question I liked actually. I have never thought, like from exercise, when especially sweating is amelioration, then why do they have that? I never thought like that. I thought, yeah, it is due to the excessive sweating and also maybe some chemicals. It's not just the salt, but other minerals are also that are coming out. So might be that people will be itching, and then the urticaria starts. That's how I always thought. But sweating
Mhm.
amelioration, then still why they have? I never thought before to you. I mean, before you asked, I never thought. So when once for the exam, once we say this symptom, then
Huh?
teachers will be asking all the questions that I told you. So they will ask
Mm.
what is urticaria from shellfish, blah blah blah. So that is why I gave importance for that as an MCQ. But in your way, I don't know. Maybe I will check, but I don't know whether I could get the answer. I can check and see whether what is the explanation given or how it is being connected.
Okay.
Uh, yeah, this feature, another features of hangnails or anatomy of the skin, if you have noticed, they have problems in this border where the skin and the hair is meeting.
Mhm.
That is the place where they have the skin problems. So leave the hangnails, dry and cracked, but the herpes about anal region, the borders of hair at nape of neck, then
Mm.
eczema on edges of hair. So wherever the skin and the hair is meeting, that edge, that is the place where natramure will be having the complaints.
Okay.
Okay. Then natrum self, it is simply connecting to the gonorrheal feature, the granular eyelids, like small blisters, and from that the this one ophthalmia netter, what is a study on the toja argenta nitricum, the same psychotic symptom. So natrum self also has got that granular eyelids, like small blisters, and green pus will be coming out. So same ophthalmia neonatorum. There will be photophobia, and that is gonorrheal or psychotic.
Okay.
So that is with our Natrium group. Tomorrow, when shall we have our class?
Also in the morning, I guess.
Mm, I have class with Farha from 9 to 11.
Okay, then can we start at 11? Because I have class in the afternoon.
11:30.
Yeah, 11:30 sounds okay.
Okay, and then we finish 1:30. I mean, okay, let I see, because I don't plan to take too much for nosots, because it's only sorinum you have been taken, right? Not
Yeah.
medorinum, sertralinum, ticopecula, nothing has been taken. So I'll be just concentrating with the common features. Not I won't be going for individual drug comparisons, because it won't end unless you study all the drugs. It is going to be very difficult. So we'll do with the common features as simple as possible.
All right.
Okay, so we'll see tomorrow 11:30 to 1:30. So after that, 2 to 4, I have again class with Farha. I'll
Oh,
make it,
okay.
yeah, I'll make it 2:30 or 3. I need to take lunch in between. Okay, so only this week. I mean, your class will finish this week. So then
All
it
right.
will. Uh, uh, so what was next? Did you take the screenshot?
Screenshot? Yes, I've sent it to you.
Okay, okay. Thank you, Farah. See you
All right,
tomorrow.
thank you, Miss. See you tomorrow. Bye bye.
Bye bye.